Just go through some of the profiles that we have. Some of the early content profiles, XDSMS, the Emergency Department Referral or EDR, XPHR, which is Exchange of Personal Health Records, and patient portals, and which deals with patient portals and the EHR. I'll let everyone read that. There's no need for me to say what. These were some of our early content profiles. As PCC matured, we started delving into other areas like clinical decision support. QED is one of those, care management, retrieve clinical knowledge, and request for clinical guidance are all examples of our clinical decision support profiles. Our largest body of work surrounds content for particularly CDA or clinical document architecture profiles. A lot of these are listed here, and we've tried to give a little bit of color coding to differentiate between the groupings of the different profiles and the areas that we have focused on in the past and continue to focus on. It's a nice colorful slide. We've left pink on the perinatal profiles, which is very nice color. There's quite a few in that realm. If you want to read up on any of these profiles, you can go to the IHE.net webpage, find the PCC technical framework, and you'll find all these profiles listed there, and you can read up either on the wiki, which is linked from that page, or you can open up the technical framework and read the actual summary within the profile if any of these catch your attention and think that these might be something that you're interested in. There are a few that we added this year that are also made it on these screens. Beyond content, we've also done a lot of integration profiles that help with exchange of data that is beyond just content. Several of them, again, having to do with nursing and care coordination. Some that we added last year. Referral order linking, the RIP routine interfacility patient transport. So a lot of good profiles that help with the coordination, and we're calling them integration profiles. We also have workflow coordination profiles. Now these are a special type of profiles that allow for workflow coordination using CDA documents or document architecture. These are all listed here too. So if you think that and the reason that PCC has dwelled differently in integration profiles versus workflow profiles is very dependent on the implementation architecture that the organization or the region that the organization is working with have. So if the implementation architecture tends to be very document focused, then these workflow profiles might be a good place to go. If it's not document focused, you know, if you're coming up with new FHIR technologies, you can look at the FHIR ones. There are others that use XML-based exchanges and so on. So we've categorized them so people can try to find the ones that might apply to them the most. We also, as I mentioned, work very heavily with other domains. There's a lot of cross-domain work going on, and every year we tend to do that. Remote patient monitoring is one that we're doing with patient care devices. Cardiovascular heart, XCHT, workflow definition was with cardiology, so on. So these profiles, PCC has the expertise of how do we do this in a general way, and then we work with these other specialty domains to say, okay, let's work together to figure out what the right content is that we need to exchange, what are the right tools that we should use electronically to exchange that data. Okay. Now, I'll take a few minutes to walk through some of the new profiles that we have done work on in this past cycle. In particular, I'm going to go through 3 of them. First one is the Dynamic Care Planning DCP profile. This uses FHIR, so those that are interested can take a little bit more of a detailed look again on the IHE.net website. Under PCC's technical framework, you'll be able to click on this particular profile name. Dynamic Care Planning really provides structures and transactions for care planning and sharing care plan definitions. And that examples of those are order sets, protocols, practice guidelines, etc. And the profile does that with a few different types of transactions and queries. It allows for discovering of care plan definitions, creating and updating care plan definitions, providing a list of care plan definitions, then also individual care plans. We can discover individual care plans, create and update individual care plans, or get a list of all of those care plans. The purpose of DCP is then to depict, is to really ease the sharing of care plans between providers, patients, and payers. Anybody that needs a care plan for a patient, we can update it, create it, manage it, and so on, and electronically share and do all of these things. So it's a profile that does all the complete work there. And the ability to update it dynamically while the patient is getting their care is really a powerful piece in here. So it allows for several different additional aspects that are really fantastic, that has made this a very wholesome profile. And as usual, it does use some underlying standards. It uses the HL7 FHIR resources of care plan, plan definition, activity definition, and subscription. And it also uses the HL7 coordination of care services functional model. Here's a pictorial view of what the actors and transactions in DCP would look like. If you want to read up more about these transactions, feel free to open up the profile and take a look at it. Links will be available in this presentation and also on the IHE.net website. But in general, there are 3 actors. There's a care plan service, a care plan definition service, and then a care plan contributor. All right, the next profile that I want to talk about is the Paramedicine Care Summary, or PCS. This also uses FHIR and also has a CDA component. The Paramedicine Care Summary really takes information derived from available CDA content and also FHIR resources to then electronically communicate the vital information about that patient between the paramedicine transport system and the EHR. So the purpose here really is how do you exchange that data, either one way, it could be bidirectional, right? It can go from one direction or the other, where the emergency transport or paramedical system transport system needs that data, or that they are providing that data to the hospital system or the EHR. The big purpose here, of course, is that it decreases the time gathering that important information. All that is electronically exchanged between the 2 systems, thereby allowing the nursing staff and the paramedics to focus on the actual delivery of care to the patient in these scenarios where often it is quite emergent. So there are other great aspects to this profile. You can share quality metrics if necessary. There's 2 approaches, as I said, the CDA and FHIR. Both approaches use the document sharing PCC1 transaction. Again, to read this transaction is available in our technical framework. Finally, I wanted to talk through the Cda document summary sections, or the Cda Dss profile that we worked on this year. The idea of this profile is that Cda documents over time have gotten fairly large and complex, and sometimes there is a targeted need for sharing that document, and that can be summarized in the summary section of that Cda. It could either be it's more of the reason of here's the reason this document exists, or it could be a summary of some of the key highlights that you want a targeted provider to focus on. So very powerful to cut down the time somebody might need to go dive in and take care of that patient. So the idea is that the receiving system would receive that Cda document and could immediately display the summary section to that provider, who can then take action, and then if they need to dig in, they have the entire Cda that they can go through and dig in. It could be a very powerful tool for physicians to sort of communicate with each other when sharing information about a patient. Again, the idea is this is the content profile. It just shares using all the content infrastructure and framework that PCC content profiles already use.